Hello, everyone. Thanks for joining. I am Dr. Monica Tillett. I'm a doctor of physical therapy and the owner of New Direction Rehabilitation and Wellness. And we are a mobile outpatient clinic serving adults here in the Triad. And our goal is to help them age well. And that includes helping them avoid falls, helping them with pain management, helping them with exercise and strengthening progression, all for the goal of maintaining independence at home and in the community. So I want to talk about what the difference is between my clinic, which is a mobile outpatient clinic, versus a home health care company. And there are major differences, but one common similarity. And the first common similarity is that we perform services in the home. Okay, so home health care performs services in the home, and our mobile clinic, outpatient clinic, provides services in the home. That's the only similarity. Now, let's get into what makes them different. So the first thing that makes us different is that we bill the insurance differently. So a home health company is going to bill the insurance under your Part A benefits. Our mobile outpatient clinic is going to bill your insurance under your Part B benefits. And that is a major difference when it comes to what we can do with you and the services that we can provide. The home health clinic or the home health company can only, they're following restrictions as far as how many times they can see you, how often they can see you, how long the treatment sessions can be. And the outpatient clinic, which is my clinic that bills the Part B services, our only requirement is that we're providing services that are considered skillable services for the insurance company. So if we're providing a service that the insurance considers reimbursable, then we bill your Part B benefits, and we can set the proper frequency and duration. Some clients we see twice a week, some we see 3 times a week. Our total knee replacements, total hip replacements, we see 5 times a week. And we see our clients for an hour. An hour sounds like a long time, but actually it's the right amount of time to get some focused care in and some education and with the client and caregivers. Okay, the second thing that makes us different, and it's really important, is that with a home health company, you have to be considered homebound. And what that means is you're not able to leave the house, or if you are able to leave the house, it is a significantly taxing effort for you to do so. My mobile outpatient clinic, you do not have to be homebound. Again, because we're billing different parts of your insurance is what makes these rules different. So our company, you don't have to be homebound. You can still get out and go in the community. We just make sure that what we're providing for you under the insurance guidelines are, needed services and what they consider skilled services for care. Our goal as an outpatient clinic is for you to be in the community, for you to gain independence. It's not for you to stay at home. And because this service is new and most people don't really understand, they just know it's in the home and it's home care. They don't understand that they have different benefits under our care. And the last difference that makes our mobile outpatient clinic different than a home care company is that you don't have to have a doctor's order depending on what services we're providing. So if it is a service that the insurance will pay for, we will bill the insurance. And yes, at that time, we need a doctor's referral. But if you want services that aren't covered by the insurance, and yes, there are many times that people want services that aren't covered by the insurance because the insurance is very limiting at times with what you can do with the client. But for those clients who want us to come and help them maintain their wellness or be their personal coach, you don't need a doctor's order for that. For those clients who want us to come in and give recommendations on home modification or training caregivers, we do contractual management, so many different things. And there are, like I said, instances where a doctor's order is not needed. So what I encourage you to do is don't wait to see your doctor. Don't wait to call your doctor. If you have questions about what can be done for you to help you, then I encourage you to call us directly. And then after our phone consultation, if I find that it's something that we need to, consult with the doctor and get an order and do all that, then we'll do that. But it's important to call us first, talk about what your issues are, talk about what your goals are. And then from that point, we can establish where we need to go in order to begin services. Another important benefit of having our mobile services, we start services faster. If you are available the same week, most oftentimes we will start our clients the very same week. If not, the next week you get started. So you don't have to call the doctor, wait for them to send a referral to us, then have to go through scheduling, all that. Like, we're cutting out all the middleman. And that's because we want you to start getting better faster. And so another thing is that we can meet you where you need to be. So yes, we provide services in the home, but if going to the gym and establishing a routine in the gym that you feel comfortable with and safe with, then we meet you at the gym. If going to Walmart is taxing for you, or reaching down to get items or reaching up to get items, then we may take a couple of sessions and go to Walmart and work on those specific things that are specific to you. Of course, it's not going to be in a way where people know that, we're a therapist and we're helping you. But that's just to give you an example of how we can adapt our services to meet your needs and to meet your goals, and that to let you know that you have available to you services that can be an hour long, twice a week, 3 times a week, or it can be 5 times a week based upon, if you have a condition like you're post-surgery and you need 5 days a week therapy. So just know that with the mobile outpatient clinic, you get more. And we tailor the treatments to your goals and your abilities. And so it's just a great service. And I wanted to do this educational video because I'm having lots of conversations with doctors. I'm having these conversations with insurances and also clients. And because they're not used to an outpatient clinic providing services outside of the clinic, it's a learning curve, and that's fine and that's great. Just because it's something that is not used to being done doesn't make it wrong. But getting an understanding of how we work, what our billing structure is, then, that's what needs to be done. And so I encourage you to give us a call, 336-283-5028, or you can check out our website. at newdirectionrehab.com. And let us know if there's anything that you have questions about or that you need help with.